wanted to bring our members closer to what will be on the table at the meeting, and including hearing from those who will be at the meeting and in attendance at this event. So we will be able to bring TB to the forefront amongst many of the world's influential leaders. And with that said, I would like to hand over to my colleague who will introduce our speakers for this session.
Thank you, Nolwazi, and good afternoon. So our speakers today include Mr. Mike Frick, who is one of the co-directors of Treatment Action Group, Global Tuberculosis Program. He holds numerous portfolios, including advocacy to support universal access to TB prevention and preventive treatment. He holds an MSc in Global Health and Population from the Harvard School of Public Health and was a Fulbright Fellow in Yunnan, China. He will be sharing with us the Treatment Action Group's advocacy asks for the meeting. We also have Lana Syed, who is the focal point for community and civil society engagement at the Global Tuberculosis Program of the World Health Organization, with more than 20 years of professional experience in public health, in policy setting, support to countries, project management, monitoring and evaluation, in community engagement in health. She holds a master's degree in ethics in health from Warwick University and a bachelor degree in sociology and psychology from Webster University. Recently, she was a key part of the social listening session held with civil society in South Africa. She will share insights from the World Health Organization going into the United High-Level meeting. We also have Mr. Phumlani, who is a veteran with more than 3 decades in communications field. He is currently a director of advocacy, communication and social mobilization in the National Department of Health TB cluster. He has been in the forefront of advocating for improved TB messaging that speaks to vulnerable communities and South Africans in general. He has played a pivotal role in the recent social and behavioral change communication strategy for TB, which is in the process of launching nationally. Mr. Ximiya will speak about goals of the South African Department of Health delegation at the United Nations high-level meeting. So we will hand over to our speakers, starting with Mr. Mike Frick. Thank you.
All right, thank you very much. Thank you for having me. Hello to everybody. Let me just pull up my slides and then we'll get started. And I'll maybe ask the chairs to let me know when the slides are showing correctly. I sometimes have trouble with Teams, so I'll count on you to let me know when it looks good.
Yeah, we can see the slides now.
Okay, perfect. All right. Well, good morning to everybody from here in New York, where it's still quite early, and we're looking forward to welcoming many TB advocates and government leaders to our city in less than 2 weeks now for the second ever UN high-level meeting on TB. I'm really happy to join the TB think tank today to present some of the global advocacy that has been leading up to and will occur at and after this high-level meeting, and hopefully have a good discussion with everybody about what some of the hopes, challenges, and opportunities are that this event affords us. I wanted to start by representing the official theme of the meeting as set by the Office of the President of the General Assembly, which is advancing science, finance, and innovation and their benefits to urgently end the global tuberculosis epidemic, in particular by ensuring equitable access to prevention, testing, treatment, and care. And I start here to emphasize the fact that science is forefront at the theme of the meeting itself and has been at the center of the negotiations leading up to it. And because science is defining the theme of the meeting, and because I'm talking to the TB think tank, my presentation today will focus on global advocacy for TB research and development. There are lots of things that the high-level meeting will discuss and touch on. I'm sure Lana and others will describe some of the sort of bigger issues, but I'll focus on the scientific part of it. And I think it was really interesting for me as a TB research advocate to see that this became the theme, because in this sentence, the words underlined reminded me a lot of other UN documents that I was reading and working with at the time, in particular some of the international human rights treaties, which have established what we call the right to science, which is the right of everyone to participate in and to enjoy the benefits of scientific progress and its applications. And so the fact that the theme of this meeting opens with science, refers to scientific benefits, and defines those as access to prevention, testing, treatment, and care was, I think, very interesting indeed. So the point of a high-level meeting, one of the outcomes of it is to create a political declaration. And the declaration is where promises are made in the form of commitments that UN member states agree to take collectively and individually within their jurisdictions. And at this high-level meeting, the goal is to create a concise and action-oriented political declaration that will follow the one that was last created in 2018 at the first TB high-level meeting. And in terms of research, that meeting set a very important promise, which was that governments committed to mobilize at least $2 billion a year for TB research. And the long quote on this slide shows you how they expressed that in the 2018 political declaration. They talked about mobilizing sufficient and sustainable financing. They referred to closing the funding gap of $1.3 billion. In order to raise at least $2 billion a year for TB R&D. And in red, they said that they would do this by ensuring that all countries contribute appropriately to TB research and development, an idea that I will come back to in a few slides. So promises were made and then quickly dashed and broken. Each year since 2005, Treatment Action Group has collaborated with the Stop TB Partnership to conduct a global survey of TB research funding. We survey public, philanthropic, multilateral, and private sector companies to ask how much they spent on TB research in the previous year. So this allows us to track progress against that $2 billion commitment that was made. And what we can see is that although funding for TB research has increased significantly over time, especially compared to 2005 when we started, it still falls short of that goal that UN member states set. So in 2021, the last year for which we have data, collectively the world spent just over $1 billion on TB R&D. So we're about halfway short of that $2 billion goal. And if we adjust those figures for inflation, we see that actually the progress that we're making nominally is, facing these headwinds of kind of the change in purchasing power over time. So we have a lot of work cut out for us. We haven't been able to satisfy that central TB R&D promise made in 2018, which sets up this high-level meeting as an opportunity to reassess the target and reassess the commitments and actions we'll take toward meeting it. And we saw that progress was lacking in every area of TB research that we track. So the Stop TB Partnership Global Plan has set specific TB R&D funding targets for different areas of TB science, from basic science to product development for new diagnostics, drugs, and vaccines. And the target set by Stop TB is represented in this slide by the length of the red bar, and then in blue is the actual spending toward that target in the global plan. And so you can see that every area of TB research and development is underfunded, but the gap between available financing and projected financing needs for TB research is wider for vaccines than for any other research area. And I want to dwell on vaccines for just a minute because that's really the need of the hour, and we're on the precipice of conducting several large late-stage clinical trials for new TB vaccines. South Africa is taking a leadership role in this and honestly always has for TB vaccine science. And we know that we can't end the epidemic without new vaccines. So in 2021, the world spent only $121 million on TB vaccine research. And of every dollar spent in this area, 62 cents came from public funders. So government spending and action in this area is really critical because governments make up over half of what is spent on TB vaccine science every year. Very little money spent on TB vaccines from the private sector, and no reported investments from multilateral donors, groups like CEPI or other multilateral mechanisms that would fund vaccine research for other diseases. And when you put these numbers in comparison to what we know the world can mobilize for vaccine research from the COVID experience, it looks really pathetic. From 2009 to 2021, that whole period, the world spent just over $1.3 billion on TB vaccine R&D, which is, like 1% of what the world spent on vaccine research in the first year of the COVID-19 pandemic, if you count the advanced market purchase commitments made for COVID-19 vaccines. So we're in a totally different universe of sort of financing when it comes to TB compared to COVID and other diseases. The issue with all of this is that broken promises from 2018 create a heavier financial lift for the future coming into the 2023 high-level meeting. And if we underspend in previous years, that means we need to spend more on TB research in the coming years in order to make up funding shortfalls. And at the same time, we're coming into this 2023 high-level meeting with TB science having matured to a point where we know we're going to have to spend additional money. We have some phase 3 TB vaccine trials we need to conduct, which will be hugely expensive. We have next generation diagnostic development, building off COVID-19 diagnostic outlays, and we have research on new TB drugs and drug regimens. And then of course, a whole agenda of basic science and operational and implementation research that we need to fund. And so for these reasons, Stop TB in their new global plan, which looks at the actions we need to take through 2030, has revised that TB R&D funding target and is now calling on stakeholders to mobilize $40 billion in financing for TB R&D over the next 8 years, or what works out to around $5 billion annually. So in other words, our annual research funding must increase fivefold from the $1 billion that we spent last year to at least $5 billion a year. And this is going to require that existing funders give more and that more funders enter the space. And it's going to require that our governments renew and reinvigorate the commitments that they've made for TB research, that they each give their fair share. And this brings me back to that red sentence that I highlighted on the second slide from the 2018 political declaration, where member states said that they would raise money for TB research by ensuring that all countries contribute appropriately to research and development. And this is, I think, a good illustration that part of our job as advocates, scientists, policy people, is to take the political declaration and interpret it, together decide what it means. Because this sentence from 2018 was intriguing, but a little bit vague. It needed our interpretation to define what an appropriate contribution looks like. And so we came together with other TB advocates to say an appropriate contribution is each country giving its fair share to TB R&D. And then we defined what fair share means. We said, what if we took that global target of 2 billion and we broke it down into national level targets and created specific advocacy asks that advocates could take forward with their own governments and raise money for TB research. And so these fair share targets, as we call them, account for what countries already spend on R&D while affirming TB research as a shared responsibility. So everyone must contribute something. And so in 2018, against that 2 billion target, the fair share target was set at 0.1%. That is, we asked and expected that each country would spend 0.1% of what it spends on all forms of R&D on TB R&D. And if we did that, we would raise enough money to satisfy that $2 billion ask. So now that that number has gone up from 2 billion to 5 billion, and now that we need more money for TB research, we need to revise the fair share targets. So we have been working ahead of time, ahead of the high-level meeting to do this, and have established a new fair share that governments now need to spend 0.15% of what they spend on all forms of R&D to TB R&D in order to reach that $5 billion that we're hoping member states commit to when they come into New York. And so what this looks like in dollar terms is, for example, my country, the United States, in 2021, the US government spent a combined $416 million on TB research. But if we were to satisfy our 0.15% fair share target, the US government alone would need to spend over $1 billion each year. It seems like a big difference, but I think we can do it. And for a country like South Africa, we had reported spending on TB research of just under $5 million from the South African government in 2021. The 0.15% fair share target for South Africa is $7.7 million. So progress that needs to be made as well. And what this framework gives us is what this target gives us is a framework really to make a specific ask that we can track over time and to make that ask of our own governments and then follow up on the progress. And the reason we're so focused on governments is because, as I said earlier, we know that most money for TB research comes from the public sector. So this graph is showing you that last year, 70% of the reported expenditures on TB R&D that were reported to TAG and Stop TB Partnership came from the public, came from governments. And so government action and commitment is really critical and will determine whether or not we meet our TB research goals. And that brings us back to New York and the high-level meeting. I can't say it better than Marcus Lowe, who published a fantastic editorial in Spotlight. I know you all read and know this publication well, an opinion piece about the UN high-level meeting and whether or not it's worth it. And a point that Marcus made that I think is really critical and is also sort of behind the fair share targets and the idea that motivates them is that governments are ultimately accountable to their own people. And for something like TB, the most important accountability levers are domestic. So in New York, we can gather, we can raise international attention, we can set commitments, but ultimately it's going to depend on the work that happens at home in each of our contexts and places. And so groups like political parties, trade unions, domestic civil society, domestic researchers, they are actually critical in making sure that governments live up to the commitments that are expressed in September. And that this goes much farther than, as Marcus put it, some politely expressed peer pressure in New York or Geneva. And so looking now at the high-level meeting, we have a sense of the political declaration. It's been negotiated over the course of this Northern Hemisphere summer. And we have a sense of how TB R&D fared in the negotiations. I'm a member of the Civil Society and Communities Hub, which is sort of helping to coordinate advocacy ahead of the meeting. And they put out this resource that I'm showing here, which is a kind of scorecard assessing where the latest draft declaration is in relation to the hopes that we had for it and the key asks that we had. And if we look at the declaration, there are about 11 paragraphs that focus explicitly on different facets of TB research and development, everything from financing to different research goals, how do we collaborate internationally on science, participation in science, access to scientific benefits, manufacturing, and other issues. And on the positive side, we have seen that member states have come together to set a specific measurable target for TB research and development. But on the less positive side, this target has also been watered down to a certain extent. So whereas we know, according to Stop TB, that we need $5 billion a year for TB research and development, in the draft political declaration as we have it, this has been expressed not as an annual target, but as something to reach for over time. Member states have said that they'll mobilize funding for TB research toward reaching $5 billion by 2027. So a target that was meant to be really a floor has in a way become a ceiling, which I think is concerning. But something we can be proud of, and this brings me back to the beginning of the presentation, is that science as a theme became expressed in the political declaration as the right, a human right to enjoy the benefits of scientific progress. And in several places, the political declaration explicitly acknowledges this right. And this is something that I think we can be very proud of, because it frames TBR&D as a government responsibility. Human rights are about what our governments owe to us. And it's also the first political declaration on health on any topic to explicitly recognize the right to scientific progress. And the fact that it happened first for tuberculosis, I think, says everything about our job in the epidemic that we're fighting. So my bottom line takeaway, I guess, is that, coming into New York, it's not everything we asked for, this political declaration, and the things within it are not always expressed the way we would like them to be expressed. But my overall sense is that science is a much more prominent theme in the 2023 political declaration compared to 2018, and that the real work begins at home. My advice, I guess, is when the political declaration is adopted by consensus, as we hope it will be in 2 weeks' time, to take that document with its 80 plus paragraphs within it, read it, find the paragraph or the sentence within a paragraph that means the most to you or speaks the most directly to your work, and work over the next 5 years to bring that paragraph or that sentence to life and achieve it. And I think if we each take the political declaration and divide it up this way, speak to our governments about it, and expect them to act on it, then in 5 years' time, when we meet again at a possible third high-level meeting, we'll have gotten far way down the road. So with that, I will leave it here and turn it back to the chairs for the next speaker. Thank you.
Thank you, Mike. We will now hand over to Ms. Lana Syed.
Greetings and thanks a lot for this invitation. While I'm uploading my presentation, just to say, as I was introduced, my name is Lana Syed. I'm a staff of the Global Tuberculosis Program in the headquarters of the World Health Organization. Pleasure to be here with you today. I have quite a number of slides, which I can share for everyone to have more information on what we'll be talking about today, but I will not go into as much detail as you will see on each of the slides. Can you see my slides, please?
Yes, we can see them.
Is it full screen now?
Yes, it is full screen now.
Okay, super. And okay, what I will talk you through today, are the slides moving? What I have on my screen is community, no, they are not moving, community listening and community feedback. If I go through the slides, are they moving or not? No. So sorry, just 1 second, because it seems that 1 second. Teams is a little bit misbehaving. Are the slides moving, please?
Yes, they are moving now. Thank you.
Okay, excellent. So I will talk about this kind of new, relatively new initiative that we've taken up at the WHO, whereby we took the opportunity of actually the UN high-level meeting to kickstart this process of promoting and helping the WHO country and regional offices embark on this social listening exercises. So what are these? mean, social listening is a broad term that, depending on the implementer, people use in a number of ways. But we are, in this sense, we are talking about how, at the level of WHO, we can really capture the community opinions and conversations which are happening on the ground and which are shared by community members. Why is this important? Social listening, broadly speaking, helps the stakeholders ensure that the focus is on the right topic. It can help tackle misinformation. It can help highlight communities' capacities and suggestions. It can help any health intervention, including TB, to be people-centered, and it can help build trust among what can be quite diverse, stakeholders with different comparative advantages and so on, such as community representatives, national TB programs, WHO, and so on and so forth. So also importantly, this is the slide that we see is a visual from our new community guidance, and we say, in any context in this world, in a country affected by TB, the country can be at, if you like, at different levels or different stages of community engagement. But really, no matter what type or level of community engagement a stakeholder would like to implement or be part of, the step number one is really to start with listening to and learning from communities as the sole and number one context specific experts. Also to mention that, we looked at kind of preparedness and response, not only from COVID-19, but also beyond. And the concept and the importance of social listening and social participation is picking up momentum, and we are happy to be moving shoulder by shoulder with a number of kind of health initiatives in really placing centrally social listening in a health response. So what were the objectives? Why, as I said, probably the UN high-level meeting is an absolutely key milestone for this year in tackling TB globally. But really, we as WHO want to make sure that in TB response, in the guidances and assistance to countries that we give, that the views of communities and people who have had TB and people who are at risk of TB at the grassroots level, that their views, opinions, and priorities are really centrally placed in local and national efforts to end TB. Also, we've embarked on this earlier this year to be able to document through a number of social listening events, which in a second I'll go through, and synthesize them in a kind of a document summarizing the key requests and inputs by the affected communities and civil societies, particularly targeting the 7 UN high-level meeting on TB. As well as to, lastly, on rather ongoing basis, help strengthen the meaningful engagement of communities and civil societies with WHO and with the national programs, so that they can really be a fair and equal partner around the table. So this is very briefly where we are today. So this is an ongoing process which started in March last year, and we are working together with the Civil Society Task Force on TB, whose very active member is Professor Harry Hausler from South Africa, working together with the task force and the WHO regional and country offices to really kind of institutionalize this approach and to, on regular basis convene these events to really have an open and meaningful dialogue with the grassroots communities. So to date, we have convened, helped convene events in all at the global level, as well as in all regions, WHO regions of the world, including 6 or so country level events. So this meant that collectively over 700 stakeholders representing, TB affected communities and TB survivors and different representatives of communities and civil societies and their groups, as well as healthcare providers and other stakeholders were collectively, participating in these events, as I mentioned, convene at the global, regional, and country levels. So what this yielded is we've, analyzed reports of each individual initial social listening exercises, and we were able to probably identify 4 broad themes in terms of what the communities and civil societies are telling us are their priorities and demands. And you can see them on this slide. From the left-hand side to the right, they can be grouped into funding, meaningful engagement, the importance of meaningful engagement at the country level, advocacy and advocacy by TB affected communities for, strong people-centered approaches, and lastly, innovation and demand creation overall, including for TB vaccines. So a little bit more detail on each one of these. So the first broad category was, as we said, that there's a need to ensure funding for holistic and universal access to TB prevention and care. This entails identifying clearly what the funding gaps are, to institutionalize funding, both for national TB programs as well as, communities and CSOs as a continuum rather than an add-on of the national tuberculosis programs, including, not only fair financing, but also ensuring that the health system can provide programmatic support and making sure that the community systems are strong enough with dedicated space, staff, resources, both financial and capacity and human resources, so that they can, perform well the role of community representations in these 4. Furthermore, on the topic of ensuring meaningful engagement at the national level and the national programs, what is coming out very strongly and uniformly that communities need to be part, not just at delivering services at the community level, but in the decision making processes in development of national strategic plans, in processes around the multi-sectoral accountability, in the implementation of plans, and in review of those plans. Secondly, that community-led monitoring is something that needs to be kind of scaled up as a mechanism fully owned by local communities. And then these outcomes of community-led monitoring can be effectively taken up and discussed with the national programs to come up with the joint solutions. Similarly, that it's important to scale up multi-sectoral approaches, and as well as develop capacity strengthening platforms, which are there to respond to community identified needs and priorities. As the next one, we had the importance of advocacy for people-centered approaches. And through the social listening exercises, we heard that TB-affected communities must advocate for integrated and people-centered approaches to make sure that, you know, that the quality services are there, that the access to them is equitable, and for everyone and anyone. So basically, to make, if you like, community universal health coverage a reality, and make sure that each and every individual, irrespective of which you know, population they belong to, can easily access those services. And finally, to make sure that capacity strengthening is an area taken very seriously, and that capacity strengthening is not just limited to the capacity of communities and the civil society representative, but also that the health systems are incapacitated to really, you know, engage communities and engage with communities systematically and meaningfully. And the last one was about the innovation and the TB vaccines. So there is I think, a universal recognition that there were a number of lessons that are really valuable from the COVID-19 response, and that it is still an opportunity for the TB response to learn from some of these examples and lessons learned during COVID-19, to see how, you know, really the communities which were at the forefront have developed their own responsive plans, and how some of these lessons can be, you know, can be useful in further strengthening and accelerating efforts to end TB. There was also a, you know, importance put on countries moving much faster in adoption of the shorter regimens, and the community role within that, including the need for investments in new technologies to end TB, and the kind of overall, the last point is kind of the umbrella need that, you know, more investments are needed to ensure that communities can really maximize their own capacity and play the full role that they can in TB research and development. So, in conclusion, this is my last slide. I think the initial feedback from all the country offices and regional offices that we helped convene the social listening exercises together with the WHO Civil Society Task Force on TB, that it is a major step in the right direction, that it really helped them start understanding the grassroots perspective of the communities, and to try to, you know, systematically collect and document this demand that's coming from the grassroots, and that it helps, you know, build trust between this, you know, traditionally and fundamentally very different stakeholders around the table. So this is something, as I said, that we will be pursuing going forward, not only as the Global Tuberculosis Program, but I think institutionally at WHO. Particularly on these series of exercises, they have been already, the report, synthesized report has been produced and has been shared in May in the context of multi-stakeholder hearing, which is formal, as you know, part of the process towards UNHLM, and will be now again, you know, made available and made available and shared at the UN high-level meeting a bit more than 10 days from now. So this was it from me. Thank you very much for listening. I'll make this presentation available. I'm here for any questions, and thanks so much again for the invitation.
Thank you so much, Ms. Lana Syed. Colleagues, please be reminded that you can post your questions and comments under the Q&A tab, which will be addressed after our third presentation. So we will hand over now to our last speaker, Mr. Phumlani Ximiya.
Thank you, Olwazi, and good afternoon to everyone. The name is Phumlani Ximiya from the National Department of Health, TB Control Program, and I'm responsible for the ACSM arm of the program. When I got the request to make a presentation, it was stated as what is it that South Africa wanted to get, that is from the UNHLM on the 23rd and beyond. But I asked myself a question, is it a question of what South Africa expects from the Union, or what South Africa has committed to as part of the global community that signed the political declaration that is to be presented to the UN General Assembly on the 22nd of this month. And I felt that South Africa is one of the signatories of the political declaration against TB, which looks at the declaration itself, advancing science, finance, and innovation, and their benefits to urgently end the global TB epidemic by ensuring equitable access to prevention, testing, treatment, and care. And I felt also that I should include the declaration itself, the political declaration, because it is very telling. The intentions are very noble. This has been the case in the past, and will it still be the case moving forward, having noble intentions, but failing dismally to carry out some of those intentions. It reads like this, that is, now this is the global community. The heads of state and government and representatives of states and government assembled at the United Nations on the 22nd of September to reaffirm our commitment to end tuberculosis epidemic by 2030 and to review progress achieved and in realizing the 2018 political declaration of the high-level meeting of the General Assembly on the fight against TB. Deeply concerned that some of the global targets, very important, said that the UNHLM meeting might not be reached. And I'm sure there are various compelling reasons for that to happen. Alarmed by the adverse impacts of the COVID-19 pandemic on access to diagnosis and treatment for the people affected by tuberculosis, resulting in increases in illness and death and persistent crisis of drug-resistant tuberculosis. It goes on and on and on, but ends with achieve the targets agreed to in the 2030 Agenda for Sustainable Development and in the end TB strategy. If you go to those SDG goals, especially number 6, and the NTB strategy, you'll find that we actually found as governments and states very wanting in terms of what we had actually committed. But we're still reconvening again on the 23rd, still coming with another declaration that will be looking at also ending tuberculosis. And when I looked at the issues on declarations, in fact, as I said, that South Africa is part of the signatories, so therefore it cannot expect anything different from what it can input onto those declarations. And looking at those declarations, which are more than 80, and all of them telling and looking at universal healthcare, communicable and non-communicable diseases, health system strengthening, etc. And more than 80 of them, but I managed to squeeze out of the 80 only about 10 or 12 that will have a stronger bearing on the South African situation. The first one, the copy of the declaration is available. I'll make it available to the organizers of the meeting, and I'm sure also you will have sources in which you can get the declaration. But number 1 speaks on reviewing and affirming the collective commitment to the 2030 agenda on sustainable development, including the resolve to end tuberculosis epidemic by 2030. And we truly know that is quite an ambitious target, which we had actually set for ourselves as the global community. And therefore, what is required of us now as member states and individual countries to put in more resources to see to it that we actually reach those goals. And the other one was on number 4, which has got relevance for South Africa. This one recalls the Moscow Declaration to end TB. That is the one on the Moscow Declaration of 2017 that was aimed at ending tuberculosis. We had commitments also that were enshrined in that declaration, and some of those commitments have not actually been met. Not only by South Africa, that was part and parcel of coming with that declaration at the Moscow meeting in 2017, but also other countries as well. And therefore, we should be asking ourselves, are we actually going to be a talk shop of ideals or things that would like to happen within the TB space? Or are we actually going to marshal resources, human and otherwise, to actually reach some of the targets that we've set ourselves and bring about relief to people and communities that are actually affected by tuberculosis? We look at resolution number 6. I said I'm actually reading those that have got the relevance to the South African situation. And number 6 reaffirms that, yes, we made a commitment, that health is a precondition for and an outcome and indicator of the social, economic, and environmental dimensions of sustainable development and the implementation of the 2030 Agenda for Sustainable Development. And that sustainable development can only be achieved in the absence of high prevalence of debilitating diseases such as tuberculosis. It means that we still have not reached the goal of sufficient investment for us then to make pronouncements that would actually be in a position to reach the goals of ending TB by 2030. Goal number 7 also speaks on remain deeply concerned that while it has been 30 years since the WHO declared TB as a global emergency, the tuberculosis epidemic is still a critical challenge, still poses a critical challenge in all regions of the globe, and affects every country in the world and disproportionately affects the developing countries more than the developed countries. It's true, and we'll find here in South Africa, TB has got some color or class. The poorer the community, the more it is prone and susceptible to the ravages of tuberculosis. But the so-called developed or richer communities are not actually as much exposed to tuberculosis and the ravages that tuberculosis visits on them as the lower members of our societies. Okay, I will skip 8, 9, and 10 because they're basically looking at issues that have to do with equality, inequity, access to resources, dignity, and all that. But look at number 12. And number 12 has got very much relevance because it says it recognizes the profound socio-economic challenges and financial hardships that are faced by people affected by tuberculosis. That still is the case, and it still has got relevance in South Africa. We have been speaking about the catastrophic costs that are incurred by people affected by tuberculosis that's negatively impacting on the economic well-being of their families. There has been no relief in that kind of situation for the South African affected communities, and we still are far from realizing that people with tuberculosis do not incur catastrophic costs that may cause them economic harm and their families. And now we look at number 36. 36 is also very telling in that, as a country, We said that we welcome the rollout of the WHO multi-sectoral accountability framework. South Africa has actually made strides in rolling out the multi-accountability framework with various stakeholders. This has been an exercise that has taken place over a number of years, and we still probably have much to gain from the information that has been provided to us by this exercise. We are not of the opinion that we have actually excelled in terms of this exercise. We are still prone to learning more about it, and we'll actually get better and involve more sectors and be inclusive of everyone when you actually kind of compile a report that has to go to other parties that were responsible for us to actually be part and parcel of these deliberations. And we look at also Declaration number 38. It recognizes the active and meaningful engagement of civil society, people and communities. South Africa has got a very strong civil society that is well organized, and there might be some also loose arrangements of civil formations. But here we've got a very strong structure that works very closely with government, and from time to time advises government on what needs to be done. And government has got a very healthy relationship with the SANAC civil society formation and other formations as well, not only confined to SANAC, other formations. And we're looking very much forward for them to be part and parcel of the deliberations, looking at research and development as mentioned in some of the declarations, looking at how best to position, that is the discussion and engagement with regard to tuberculosis, and also how best to engage people with tuberculosis, engage them, taking cognizance their human rights, their human dignity, and actually inculcating in them a spirit of being involved and being part and parcel of their destiny moving forward. So civil society and other civil society organizations are truly crucial in this exercise. And we look then at number 38. No, that's 44. Sorry, that's number 44, which looks at committing to develop and implementing ambitious, costed national TB strategic plans, including the active involvement of communities and people as part and parcel of these deliberations. It still talks about involvement of civil society in how we move forward, involving them, and actually realizing some of the goals that we have actually set ourselves as a country in conjunction with organs of civil society. Also, number 47 and 48. 47 talks to commit to strengthen the notification of all people diagnosed with tuberculosis by public, private, and community-based service providers. I cannot emphasize this one more because as it has been apparent that we lose a lot of the people, or we have a lot of missing cases because of the lack of connectivity, but that is between the facilities and the messes. So people do not actually get their results, or do they get them late, or actually they are sent to the wrong individual. So it is very important that messes are actually informed. And I would say that we as a country are actually making strides in that regard, because we've got a information system that actually from the labs to the affected individuals, but we still have challenges in terms of people providing the incorrect telephone numbers and all that, but we're actually getting there. And as time goes on, we'll actually improve on connecting people or linking people to healthcare after they've actually been diagnosed. And number 48 is to pledge to accelerate progress towards timely, quality, universal access to TB services in both high and low burden communities. It still is our wish that each and every person that has actually been diagnosed with tuberculosis gets the results within 48 hours. and that person is linked to care within a very short space of time, so that the capacity to infect other people is actually reduced significantly, and therefore we can actually close the tap on TB infections. I've actually chosen these. There are more that actually talk to the country, but I felt these were talking strongly to our situation as South Africa and what we're actually committing to do as a country. And what is it that you can do moving forward? That is after the 23rd of, after the 22nd of September. I'll be awaiting questions and other points of clarity on that. Thank you.
Thank you so much, Mr. Phumlani Ximiya. We have just under 5 minutes, so we encourage you to participate with any questions or comments before we close this session. Just a reminder for those in attendance that if you'd like to be on this platform on a monthly basis, we have our webinars. You can email myself, which is nkosi@tbthinktank.org. That is if you would like to be on this platform in the coming months. And just a reminder that we will still have our usual webinar slots, which is taking place next week, Monday on the 18th at the same time. And the title of that is Umoya Omuhle, TB IPC in Primary Healthcare Centers, what works and how it can be implemented. And those are our presenters. Please do join us next week at the same time. So I just would like a confirmation. Do we perhaps do we have any final closing statements from anyone in the Secretariat who would like to have a comment perhaps, or any of our speakers in the absence of questions and comments? We have just 3 minutes left in our session.
I guess if there are no final remarks from our presenters and without any questions or comments, we would like to thank everyone for joining in this session, and thank our presenters as well for taking their time and the presentations that they have made. We will meet again next week. As Nolwazi has indicated, that there is our routine monthly session that is coming next Monday. So let us meet then, and thank you. Have a great day and a great week onwards. Thank you and bye.
Thank you.
Thank you.
Bye.
Bye.
Thank you.
Goodbye.